Okay, so for the medical patient assessment, the first thing we want to do before we begin anything is make sure we're wearing our appropriate BSI or our PPE. Then after that, we want to begin our scene size up. We'll first want to make sure the scene is safe and just collaborate with law enforcement if necessary to make sure it is safe. Then after that, we'll want to determine the mechanism of injury or the nature of illness. So since this is a medical assessment, we want to determine the nature of illness. Then we'll determine the number of patients. So as we can see here, we have one. Then we'll want to determine any additional resources that may be needed, any additional EMS or fire units, any just extra bodies on scene. Then after that, we'll want to consider C-spine or stabilization of the spine if necessary. Then once the scene size up is concluded, we'll begin our primary assessment. This will begin with a general impression of the patient. So you'll want to know verbalize things such as age, race, gender, the patient's overall appearance, anything visibly wrong with them. So here we have a white female in her 40s. Then we'll want to determine the patient's level of consciousness through AVPU, or if they're awake and alert, if they're verbal, if they're at least responsive to pain, or if they're just completely unresponsive. Then we want to determine the chief complaint of the patient, then assess them through the ABCs, or airway, breathing, and circulation. So for airway and breathing, we'll want to look at things such as a chest rise and fall. We want to actually listen to their breathing, listen for any abnormal sounds or any kind of irregular breathing rates. And then for our circulation, we want to palpate a pulse to make sure we actually have one. So for an adult, we want to palpate the carotid artery right here. If we can't find one there, we want to palpate on the radial or the brachial or even the femoral if necessary. And we'll also want to do things such as the blood pressure later on. And then after all that's done, we want to determine the patient priority through triage based off just their overall symptoms they exhibit, anything irregular or severe. Then after the primary assessment, we'll move on to the patient's history. So the history of the illness, for example, we'll start with the onset of it, such as when it began, palpation, or what kind of aggravates or provokes it or exacerbates it. Then the quality, which describes the overall symptoms as a whole or the chief complaint. Then the radius or the radiation, such as exactly where it takes place. Then the severity or just how much it hurts, how painful it is. And then the timing, which is when it began or exactly how long these symptoms have lasted. Then we'll also want to get the patient's overall medical history through the sample method. We'll look for the signs and symptoms, with the signs being a more objective quality, something that's more visible or observable, something empirical, with the symptoms which are things that only the patient can describe. We'll also need to know any allergies, any medications, the past medical history, the last oral intake, and the events leading up to the illness. After that, we'll move on to our secondary assessment, which is a more generalized view, a more analytical view of the respective body regions. So for the pulmonary or respiratory system, like I said, we'll want to do things such as look for the chest rise and fall, actually listen to the patient's lungs and breathing, looking for anything irregular such as an offbeat or an irregular breathing rate or any kind of wheezing sounds in the lungs. Then for the cardiovascular, we'll want to do things such as actually take their blood pressure and the heart rate. For the integumentary, we'll actually want to look at the patient, look for any abrasions to the skin, any contusions. And for neurological, we would want to, the extremities, we would want to feel them, make sure they actually have sensation in them, make sure they can actually move them. And then we'll want to get our vital signs. So we want to get a blood pressure, we want to get a pulse using the pulse ox, and we actually want to listen to the patient's breathing and actually make sure they're breathing at a regular rate. And then once all that's said and done, we'll finally move on to the reassessment. So if it's a stable patient, we'll want to reassess them after a 5-minute interval, but if patient is unstable, we'll want to reassess them after 15 minutes. And then, as all that's said and done, we'll give a verbal report to any arriving EMS units, especially if we're transferring care.